Of course, the state of Indiana sounding the alarm tonight with COVID-19 cases rising rapidly. Good evening, everyone. Thanks for joining us. I'm Bob Donalds.
I'm Debbie Knox, and cases and hospitalizations continue to surge here in Indiana because of the Delta variant. Daily cases topped 1,400 today. CBS 4 State House reporter Kristen Eskow joins us now after attending today's news conference with state officials. Kristen.
Well, Debbie and Bob, today the health commissioner said COVID-19 case levels are very similar to what we saw this time last year. She strongly encouraged Hoosiers to listen to the CDC's new guidance issued this week regarding masks, but still issuing no new mandates.
We are very strongly recommending that everyone in schools and in the state really follow the CDC recommendations with regards to masking.
Indiana State Health Commissioner Dr. Christina Box is encouraging school districts to follow the CDC's advice that all teachers and students wear masks at school, regardless of vaccination status. The Indiana Department of Health is still leaving it up to each district to decide its own rules.
We are really trying to allow and have heard clearly from our local elected officials and from our schools that they want to make these decisions locally.
Dr. Christina Box says only about a third of Hoosiers ages 16 to 18 are vaccinated, and roughly 20% ages 12 to 15. Meanwhile, experts say cases are rising most among younger age groups, including those ages 5 to 19.
Make yourselves as well informed as possible. Understand the implications of wearing masks, of not wearing masks.
With the Delta variant highly more contagious than earlier strains of the coronavirus, the Indiana Department of Health is joining the CDC, calling for more people who are close contacts with positive cases to get tested.
If you are a close contact, get tested, even if you're fully vaccinated, even if you're asymptomatic.
Now, the health commissioner says COVID deaths remain at their lowest levels in several months. Now, as for vaccinations, she says there has been a slight uptick in the first doses statewide, but they're not at the levels that she wants to see right now. Kristen Eskow, CBS 4 News.
Kristen, thank you. As Kristen mentioned, the state is pushing for people to get tested if they've had close contact with someone who's had COVID-19. The state is not changing the definition of a close contact, even though the Delta variant spreads much easier than previous strains.
The only place that's really we've been consistently a little changed is in schools and allowed the students to be at least 3 foot or beyond rather than 6 foot as long as everybody's masked. So that's the only difference. The definition of close contact has not changed.
Dr. Ray Muletti, the chief physician executive for Community Health Network, is seeing more transmission of that Delta variant from people who are vaccinated. Dr. Muletti says the vaccinated will not experience serious symptoms, but, and this is a change, they are still capable of spreading the virus.
What's different today than early summer is that we have a very contagious, as a matter of fact, the most contagious variant of this entire pandemic. The Delta variant is so contagious, it's probably several times more contagious than what we've seen before.
The Regent Street Institute is studying just how fast that Delta variant can spread. Dr. Sean Grannis is comparing this strain of COVID-19 to the chicken pox.
What we're trying to do, I think, in general, and when I see we, those who are part of the public health community, want people to have an understanding of how the virus behaves. And it's still a new virus. We're still learning about it. Chickenpox, that's been around forever, right? Everybody understands chickenpox and how that works, how quickly it can spread. And I think reasoning through analogies sometimes can be helpful.
And in fact, CDC data released today made that same comparison with the chickenpox. For perspective, Dr. Grannis says the Delta variant can spread 3 times as fast as the original strain of COVID-19.